Hi, my name is Natalia from UNES Public Health undergraduate, and in this video I would like to explain about Giardiasis. It is one of the examples of protozoan disease. So without further ado, let's get started. Giardiasis is a diarrheal disease caused by the microscopic parasite Giardia lamblia. Once a person or animal like cats, dogs, cattle, deer, and beavers has been infected with Giardia, the parasite lives in the intestines and is passed in feces. In developing areas of the world, it is common for more than 20% of a country's population to have ongoing Giardia infection. And how do you get Giardia infection? Usually you get it by swallowing polluted water, rivers, streams, springs, ponds, lakes, swimming pools, spas, and sea, eating uncooked food, fruit, or vegetables that have been contaminated or have been washed with contaminated water, touching your mouth after handling clothing, bedding, toilets, taps, or toys used by an infected person, coming into contact with animals or soil that contain animal feces, and exposure to feces through sexual contact. Who is at risk of Giardiasis? The first are children in daycare centers and their families, daycare workers, travelers to developing countries, campers who drink unprocessed water, and homosexual men because of anal sex. The symptoms are usually watery diarrhea, abdominal cramp, bloating, nausea with or without vomiting, gas, floating or unusually smelly stools, weight loss, new intolerance to milk and dairy food in diet, and low-grade fever and loss of appetite. To diagnose, the doctor has to test the stool for Giardia antigen, a protein that is made by Giardia lamblia parasites. They identify the cyst or parasite in stool samples. Multiple stool samples may need to be collected since the infection can only be detected in a portion of collected stool samples, even if infection is present. Infrequently, the diagnosis may require an endoscopy, and if necessary, your doctor can use the endoscope to take a small piece of your tissue from your small intestine to be examined in a laboratory. To prevent, we should practice hygiene. Wash hands with soap and water after changing nappies and before preparing or handling food or drinks. If hand washing facilities are not available, then use an alcohol-based gel. Supervise children to make sure they wash their hands properly and make sure foods are thoroughly cooked. Wash or peel all raw vegetables and fruit before eating. Do not drink undisinfected water. Be wary of private supplies after flooding or other extreme weather events, especially if the water looks turbid or cloudy. If sexually active, always practice safe sex. For the treatment, many people get better without treatment. But if your symptoms last more than several weeks or you're likely to spread the parasite, your doctor can give you medication. Metronidazole, nitazoxanide, and tinidazole are among the drugs used to treat Giardia infection. So that's all my presentation. I hope you guys find it useful and helpful. Thank you.